President Miguel. Thank you so much for coming to the Junior Doctors to give us your time and for us to get to know our leadership in the World Medical Association. Thank you so much.
It's a pleasure to be here, and I thank you very much for this opportunity.
And we'd like to ask you to please share your words of inspiration and motivation for every junior doctor out there who's going to watch this.
Okay. You know that when we are elected president of the World Medical Association, we can choose a theme to emphasize during our term as president of the World Medical Association. I think from my experience as a psychiatrist and seeing what is happening, in medicine in general, I choose the revalorization of the doctor-patient relationship. I think in the last decades, with the progress that medicine has experienced, with new procedures, wonderful equipments, much better knowledge about diseases, it looks to me that physicians was, in a way, losing some very important part of the practice of medicine, which is to be aside of the patient. The focus was much more in, the disease the patient has than to the person that has the disease. And also, even physical examination, touch the patient, was replaced by many different kinds of lab tests and, image diagnosis. So I think the patient is being in a position of not have enough attention from their doctors, which is the basis of medical practice. I think we have to be very well prepared in a technical way to attend what the people has and why they are suffering. But I think the suffering of the patients is not just related to the disease, it's also related for their situation in that particular time in life. And so I think we have to be, with our patients to put ourselves in their particular situation, try to feel like they feel in a way that we can understand what is happening with them. And as far as possible, as in our duties, to offer to the patient more than a prescription, more than a request for some, lab. We have to be, really aside of our patients. And I think that during this pandemic, this was much more evident because solidarity is something that was being pushed very hard as we live in an unequal world. There are many inequalities in the world. People do not have the same access or the same quality of services, everywhere, even in the rich countries. So we have to consider that as doctors, every patient, from the most poor to the most rich, they all need our attention. They all need the best we can do for them. And I think that when we realize this and try to work in this direction, I am sure that we will be very successful in our careers. So my plea for the junior doctors is, please do not lose your passion. Passions usually, fades away during our career. And we have to keep passionate, particularly passionate for our patients. This is my, recommendation for the next years of the Junior Doctors Network spread among its members.
Thank you so much for your wise words, Mr. President, and we have really enjoyed the time serving as a management committee with you and all the other leadership of the WMA.